You also cover 5 core factors of psychosocial impairment in older adults. Can you tell us about how you would go about treating these areas in a transdiagnostic or transdisciplinary way?
Yeah, and I'm hoping that clinical psychologists especially will resonate to this. Most of them have seen profiles, MMPI or PAI or MCI profiles of patients where there's some depression, some anxiety, some somatic issues, etc. And that's very much the case with older adults. And so I'm positing that there are 5 just sufficient variables that are needed for every clinician to understand well the phenomenology of a patient. And they involve the typical ones of depression, anxiety, and those two sort of battle each other out for which is the more important. But in fact, they're both important, and they seem to be joined at the hip. In addition to depression, anxiety, there's the cognition area that you just mentioned, and we devote a couple chapters to that as we've published a couple of papers on the importance of cognitive training and the importance of how cognition is part of the etiology and treatment of older adults. So in addition to cognition, depression, anxiety, there are 2 others that we feel are very important. One of those is health, and health involves a lot of things in terms of lifestyle, sleep, pain, stress, and the like, even exercise, and a bunch of components that go into that. So we have 3 chapters on that, one of which is written by a physician who targets the labs that older folks are often finding that are out of range, as well as the concept of primary care and what's involved with that and how that's best done. And finally, just the idea, just the whole idea of living when you're 70, 80, and issues of practical adjustment, socioeconomic status, cultural ones, and then the phenomenology of late life stuff that involve long-term care, caregiving, and such. Those are the issues of life. And so, so the core psychiatric issues of depression, anxiety, cognition in there, and then getting somatization stuff with health and all that's involved there, and then just the core, then just the normal living variables that go into everyday life, and those are the ones. And a profile of those and an understanding of those we believe are very important to treat older adults, and that's often not done well in other books.